This video is about rapamycin in your heart and what the new human study really shows. As we age, some of the earliest changes happen in the heart and blood vessels, often long before symptoms appear. Brand new clinical study suggests we may be able to reverse some of these changes with a safe, low dose of rapamycin. I'm Dr. Fraser, and today I'm going to walk you through this important pilot trial and what it might mean for your longevity. This study was published this year in GeroScience with 6 healthy men between ages 70 and 76 years taking 1 milligram of rapamycin daily for 8 weeks. They were closely monitored and there were no adverse events, drops in energy, or abnormal labs. But what did change were 2 major hallmarks of cardiovascular aging: the diastolic function, which is how well the heart relaxes, and endothelial function, which keeps our blood vessels flexible and responsive.
What exactly improved in the heart?
Yeah, so the diastolic function is the heart's ability to relax and fill between heartbeats. It tends to decline steadily after age 60, and in this study, rapamycin led to measurable, clinically meaningful improvements with a peak filling rate of increase of around 14%. Early diastolic acceleration doubled, and transmitral blood volume increased about 16%. So in practical terms, the heart behaved more like someone that was 10 to 15 years younger.
What about the blood vessels?
Yes, so the health of the endothelium, or the lining of the blood vessels, is a powerful predictor of long-term cardiovascular risk. In this study, after 8 weeks of rapamycin, nitric oxide-mediated vasodilatation increased by 20%, meaning the vessels opened more effectively in response to normal stimuli, and better endothelial function supports lower blood pressure, healthier circulation, improved delivery of oxygen and nutrients, less vascular stiffness and plaque formation.
But was it safe?
The rapamycin was very well tolerated. There were no adverse events that were recorded for them doing this for 8 weeks. Blood pressure, heart rate, and metabolic markers stayed stable. There was a small expected lab shift, such as a decrease in white blood cells, which is very common in individuals who are on rapamycin, but all values technically remained within normal ranges. It's important to note this dose is below typical doses used in transplant medicine. However, the blood levels were still consistent with some degree of immunosuppression, but this was only used for 8 weeks. And we saw these significant changes with just a short duration of this medication.
And how is rapamycin doing this?
Rapamycin works by modulating mTOR, primarily mTORC1, the central regulator of cell growth, inflammation, and aging. Oftentimes, as people age, mTOR becomes overactive, and it contributes to tissue stiffness, impaired repair, and chronic low-grade inflammation. Dialing it down slightly appears to restore a healthier balance, allowing the cardiovascular system to function more youthfully.
Does this apply only to men?
This first trial ended up being just men, and it was a small study with just 6 individuals. But data from mice, dogs, and other primates suggests that females may respond just as well, or in some cases even more robustly, and trials to include women are already being planned.
Should I start taking rapamycin now?
That's a big question. And for this particular indication, it would seem as though potentially doing a 8-week session of rapamycin would not be unreasonable. It's something where it should be done under the supervision of a physician. And then I think secondarily is going to be whether individuals want to be on rapamycin to slow aging in addition to this benefit, which is a separate discussion.
If I were 68 years old and taking rapamycin weekly, should I pursue this protocol for 8 weeks, then resume my usual protocol?
That's an interesting question. Given that I have a lot of patients who are on rapamycin, we don't know whether all these benefits might have already occurred with doing cyclic rapamycin on a weekly dosing. I suspect they may have. This regimen is more intense as the serum levels tended to be in the 6 nanogram per milliliter range, whereas my patients who are taking weekly rapamycin tend to probably have about 24 hours out of each week where they're above this range. So it is something where I would usually look at having an echocardiogram done and seeing if there is diastolic dysfunction. If there is, probably do this protocol and then recheck an echocardiogram. If there's not diastolic dysfunction, then I would assume that rapamycin had already done its job. So in summary, for decades, cardiovascular aging has seemed somewhat inevitable. This study suggests otherwise, that it could be significantly reversible with this regimen. It's an exciting time, and please visit me and discuss this in the event that you have interest in pursuing this type of protocol.